As Cheryl mentioned, I am a psychosocial oncology clinician with Cancer Care Manitoba. I've been there for about just under 6 years now, and there's a lot that comes up for folks, even though it's a happy time to have completed treatment and getting back to our regular selves. Much of that can be changed either physically, our outlook, etc. So there's a lot to navigate. So hopefully there's some tips and tricks you can pull from this. This won't land for everyone, so if I say something that doesn't resonate with you, that's okay. The most important thing I would like you to retain from this is that it's important to check in with yourself and what you're needing, and that everyone is going to have a different experience. So there's no right or wrong, and you get to make your own rule book, as thrilling and scary as that sounds. Okay. So when we consider all of the aspects of life that cancer impacts, it's quite normal that we would experience anxiety and overwhelm. So as you can see, these are just a few of the things that cancer affects: relationships, income, finances, if we've had to take a leave from work, daily tasks, competing with brain fog and ongoing fatigue, navigating returning back to work, how we feel about our body now, body image, and our physical recovery. A lot of people still have lingering effects or symptoms like neuropathy. We may have a new feeling towards our sexuality, intimacy. We may be grieving fertility. And fear of recurrence and anxiety is very, very common, especially in the first year. And sometimes when we're finishing end of treatment and we're checking off that last chemo cycle, or we're ringing the bell in radiation, a common experience that people have is that those around them are ready to celebrate. Finally, you're done, and we can get back to how life was. And that can be really challenging when that is so far removed from how you're feeling inside, still navigating physical symptoms, worry about what do I do now? And it can be really isolating to have everyone around you kind of ready to put this past, and you may be just for the first time ready to be dealing with the emotional aspects and the psychological aspect of what you've just been through and navigating lingering symptoms. Okay, so this could be what your surrounding people look like, and you could be feeling much, much different. So I've got a poll. If you have a chance to answer, I'm just curious how many of you have had that experience of feeling like what you're feeling inside is not corresponding to what others around you are feeling. Okay, so I'm seeing a little bit of rarely, never, but mostly sometimes and often. Yeah, that corresponds with what I hear in my office. Okay. So it can be challenging to navigate the expectations that others have on us. And it's not uncommon for friends and colleagues to think, hooray, treatment's done, you're back to your old self, we can get back to how things were. And you're feeling a little bit more like this. So let's talk about all the different ways that cancer can have a lingering effect, because it has changed so many aspects of our lives. So getting back to how things were can be a near impossible task and a big source of internal conflict. We place a lot of pressure on ourselves when we focus on where we think we should be. I hope you can park all those shoulds and just check in with how things are for you. The physical impact of treatment can linger on for quite some time, and it requires patience to build back strength, stamina, and to work on strategies to combat brain fog. A useful approach is to look at all the incremental progress we're making rather than all the things we still can't do, because that's just so discouraging and self-defeating. So whether that's celebrating being able to walk an extra block, taking a shower without needing a nap afterwards, those are huge milestones in the post-cancer recovery time, so I hope you can celebrate those small wins. It's a lot easier to notice and celebrate those than to constantly be feeling like you're failing because you're not able to operate how you used to. Okay. I'm just going to move. So yeah, friends is affected. Our social circles is affected. Our relationships often feel a big impact leading up to and during treatment. And getting used to being the one who is cared for, if we are normally the caregiver, allowing or asking others to step in with tasks they didn't normally do can be challenging what we're comfortable with. And I hope that this serves as a reminder that just because treatment ends doesn't mean we don't still need help. We also might want to revisit how things used to be. What tasks might we want to continue delegating even when we are well? For many of you, fatigue, pain, side effects of treatment can impact libido, sexual functioning, memory, even just doing simple tasks around the house. So this will affect how we're showing up in our relationships and what others can reasonably expect of us. So unfortunately, no one in our life is a mind reader. That would be awesome. So letting people know where you're at, how you're feeling physically, emotionally is really important to help them shift expectations they might have of you, and just to have an open conversation about what you're able to do right now and how you might together come up with alternate solutions. You might notice that you have less capacity for social gatherings, which means you either limit the time that you attend events or you plan for recovery days to rest afterwards. You may also be feeling vulnerable or anxious about viruses, especially as we head into the colder months. Please do what feels right for you. You have permission to reevaluate as you go. So if that's putting on a mask or not saying yes to all the holiday plans, that's okay. Pay attention also to the people or the events that feel energizing and replenishing to you, and those that might feel draining. It's okay to limit what feels draining to you as you continue to build stamina in the recovery phase. And finally, return to work can be another really big source of stress. For some people, they might be feeling joy, antsy, and excited to get back to their job, to see their colleagues, feel they're contributing again, and it's also can be a welcome distraction from what they've just been through. Others might be dreading being faced with questions from colleagues about their absence, fearful that they won't be able to perform their tasks like they used to, or they might even be questioning how they want to spend the rest of their time and energy and be contemplating a career change. There's no one right way to be feeling. Acknowledge whatever is coming up for you. And I'll talk more about strategies for return to work a bit later. I'm not sure if it's moving to the next. Okay, thank you. So physical changes continue on even though you rang the radiation bell or checked off the last chemo cycle on the calendar. Be gentle with yourself, acknowledge this difficult challenge your body has been through. And as I mentioned previously, it is really helpful to redirect our focus on the small wins, the incremental ways we are noticing progress, rather than holding ourselves to the expectations of operating as we did before. So anxiety and how we think about the future and our health is going to be greatly affected by cancer. Our brains are wired to look for threats to keep us safe. With cancer in the mix, it's normal to experience anxiety even after treatment ends. We're hypervigilant to make sure this doesn't happen again or that we'll catch it early. And it's just that operating from a place of constantly scanning for threats can be really exhausting, as I'm sure you know. So that being said, fear of recurrence is a very, very common experience, and this is typically at its strongest in the first year post-treatment. For most, it will go down as time goes on. Worrying that something has been missed, try to remind yourself that your team, they have worked with you along the way, they continue to keep a monitor and keep an eye on you for symptoms post-treatment. And also that conversation continues on with your GP. Also, if you've got symptoms for over 2 weeks, that would be when you can contact your doctor. So yes, it's important to be paying attention to those aches and bumps and all that, but we don't want that to be taking over your whole brain capacity and attention and energy. So we want to make sure that we are paying attention to those things, but that we find a kind of that sweet spot, that balance between noticing, paying attention, and acting on it if it does persist. Okay. Okay. So anxiety can actually be a really helpful tool. I know it often gets a bad rap, but our brains are wired to keep us safe. And so the fact that we are having anxiety around symptoms is really just because we want to stay healthy. So if we can reframe it as anxiety is actually our friend, it's there to help us, sometimes that lessens that pressure that we feel when we're constantly feeling anxious thoughts, or, they're creeping in at night. It's actually helpful to us. We just have to work with it. So we can acknowledge the thought and try not to let it take over our whole day. How can we change the narrative around the fear? You can keep reminding yourself that it's okay. I have ongoing checks with myself to make sure everything is okay, but I'm also going to start to engage in the things that bring me joy and live my life. And wherever you land, if you're feeling anxious prior to treatment, during, after, we get referrals pretty much across the board from folks who are contacting us before they even have a confirmation of a cancer diagnosis, to anxiety about starting treatment, or some people are just so focused on all the appointments that it's really only after it all ends that the emotions of it all, where they have actual time to process what they've just been through, catches up to them. So they might be calling us down the road after they've completed treatment. You don't have like a deadline to contact us. We're available to you at any point in your cancer journey. So please don't hesitate if you're struggling with anxiety. That's perfectly normal, and we've got a whole team that's there to support you. Okay. So these are just some notes about ongoing anxiety. Very, very normal to be experiencing that. You can check in with yourself, like after a few months. Has this improved? Is it getting worse? Is it the same? And just kind of check in with yourself. That can be a sign to you that maybe you should be chatting with someone else if you're noticing that things are staying the same or getting worse. We hope to see some level of improvement, or kind of a less of a paralysis by anxiety the further out from treatment you are. If that's not the case, that's okay. Just know that you don't have to deal with that alone. When we have ongoing anxiety, it can lead to depression. So we want to make sure we're monitoring for that as well. We live in Manitoba. The days are getting cold and dark, so a lot of people have kind of overlapping seasonal depression. But again, just kind of, yourself best. If this is feeling like it's getting worse or not changing, there are resources out there to help you. You don't have to deal with this by yourself. Some people will experience some form of PTSD from their health experience, whether that's if they had a difficult time in recovery, whatever it may be. There's a lot of different scenarios. And our bodies remember, right? We could even have stress just driving past the building where we receive treatment. The smell of a hospital can flare up a lot of emotions and memories. So pay attention to that. If you're struggling with PTSD, nightmares, flashbacks, those are signs to pay attention to, and I would definitely recommend that you reach out and either to us or your family doctor and make sure that you're not alone struggling with that. Okay, so we're going to touch a bit on how the roles have changed and the expectations have changed for you and your family. Tending to the needs and worries of others when we're also worried can be really challenging. So discussing allocation of tasks For example, can your spouse continue to make more meals? Can your teenager do more laundry? Can an adult sibling go visit your elderly parent for you more often? Those are all things that we can reevaluate. What am I needing right now so that I can continue to help myself and get stronger? And maybe there are changes that you found are helpful that can remain longer term. I'll give time for the poll. So this is in regards to our family and friends. Sometimes we are very surprised during our cancer journey, for better or worse. Many people describe feeling surprised by the people they thought would be by their side who were not, and people coming out of the woodwork. So I'm just curious to know what your experience was. So I'll leave, you can check as many options as are true to you, for you. Okay, great. So pretty mix across the board. I'm glad there's a lot of you who felt really supported by friends and family. That's wonderful. Okay, yeah, pretty even distribution. Thank you. Yeah, so there might be some grief around what we thought support would look like, and also surprise. You know, there could be that person you just waved hello to at work who's showing up and dropping off casseroles. Meanwhile, your brother or sister never picked up the phone for 2 months. So just pay attention to that. It could be helpful to lean into the relationships that are showing up for you. Name what it is that you're needing with people, and give space for those grief feelings if you are feeling let down by others. And, you know, just a caveat, many people don't know how to show up for us unless they've been through a similar situation. So perhaps they don't have capacity or they're afraid to bother you. I like to leave a little bit of grace. We don't fully understand the reasons why people pull away. But whatever the reason, if you're reconsidering, then, oh, could you go back, please? Thank you. If you're reconsidering relationships you want to prioritize moving forward, it's a very common experience. Or how much time you want to allocate to these relationships. Okay, so this is back to how cancer affects work. I will share with you the website cancerandwork.ca. This is a great tool to help identify language that you can use with your employer about where you're at with fatigue, focus, energy, and you know, any accommodations that may need to be made. Maybe you need to have time away from the larger team, proximity to a washroom, shortened days, whatever it might be. If you operate from the belief that everyone is wanting your successful return to work, that can really help. And it's important not to rush back too soon. I think that's something that we caution folks. We really want to make sure that they pace themselves. It's a huge change to be not at work and then going back full time. So if you have any capacity to go with a delayed or decreased return to work, that's usually for the best. I understand that not all roles can offer that flexibility. So try and make sure you're taking care of yourself outside of work as well, so that it's not such a huge shock to your system. And with regards to colleagues, depending on how much information you're comfortable sharing, you may want to consider a few one-liners prepared when faced with questions. Some people are open books, they're posting social media updates with photos, they don't mind who knows what their situation is. And other people are on the total opposite spectrum. Maybe they've only shared to 1 or 2 people or not at all. So you'll probably identify where you are on that spectrum. And you can have some phrases practiced depending on your level of intimacy or closeness with different colleagues. Some people also find it helpful to email their employer or a friend at work and just let them know here's a message I want the team to know before I return. I'm not comfortable with questions at the moment, or here's a brief update, but I'd rather not have questions about it right now. Whatever feels right for you is perfectly okay to request. And yeah, you can chat with your counselor if you need help figuring out what those phrases or one-liners might be. Okay, so we'll shift to poll number 3. Okay, so I'm not surprised by these results. I think there's a lot of ways that we have to shift how we are navigating life, how we're navigating the things that we used to do post-cancer. And I'm glad your responses echo what patients I chat with share. So I did want to share, this is the website I was talking about, Cancer and Work. There's a portal for the employee, employer, and the insurance provider. So it really does break down language, helps you quantify where you're at. If you just say, I'm feeling fatigued still, if you're able to measure that with, I can do 10 minutes of dishes and then I have to go sit down for 20 minutes. That's a better quantifier of where you're at, and it paints a clearer picture for them to understand what they can expect of you at this time. Okay, so I'll just touch on a few other themes that are normal and different questionings that people have after a cancer. So it's not uncommon for people to turn to their faith for guidance or strength during and following treatment. Some people who did not identify as spiritual or religious may be seeking this out now, and others who may struggle to understand why this is happening to them and question their previous beliefs. They might be feeling let down by what was a source of strength before. Okay, and considering, I touched on the reconsidering our life choices is a really big one. I think for a lot of people, it's common to feel like your life is on hold. You can't really plan for the future when you're on treatment, and there's still that hesitation even after, because we don't know, I still have my follow-ups, do I need to be around? Will it come back? They might struggle with planning far ahead into the future. Whereas others might be thinking like, I am not doing another Manitoba winter. I'm going to buy a boat in Mexico, see ya, and really questioning where they want to spend their attention. So everyone's going to have a different reaction. Don't feel like anything is wrong. Maybe don't go buy that boat in Mexico before talking to your family first, but having both extreme reactions is perfectly normal. And yeah, so that anxiety around planning for the future is very real. Okay. And finally, trying to make meaning out of all of this. Why did this happen? Why did they catch it now? Why me? Like, these are all very normal questions to be having. I hope that you're not feeling any guilt for these questionings coming up, and rather just paying attention to them and noticing them, and allowing yourself time to ponder, also allowing yourself to not have all the answers right away. And grief. Grief is a common one. Even though we might have a great prognosis, treatment, our body responded to treatment very well, there's so much grief around cancer. We are grieving the life that we had to put on pause while our friends and family could continue traveling, doing great things. And we had to halt all of that. And then we're not quite up to our our full selves just yet. Grieving the dreams that we may have had for the future, grieving what we thought our retirement would look like, and now we know the best parking spots at cancer care, not at all how we thought we'd be spending our retirement. So those feelings of grief are very, very normal. Yeah, and then finally, I'll just end on this. So managing your expectations after, I really hope that you check in with yourself, you don't hold too much stake in all the shoulds that you think you should be, where you should be at, and just really acknowledge and accept how you're feeling right now, how you're feeling in different situations with different people, environments, and that's okay, and we'll work with where you're at. That's my takeaway. Don't compare yourself to others, just honor what your experience is. Okay?
Okay, so I'm back, and at this point, thank you, Renee, for the formal part of your presentation. I think I already am getting the signal that there are a lot of questions and reflections and thoughts that folks are having. It was a jam-packed session with all kinds of themes around what is normal and valid after a diagnosis and treatment. So we'll just jump over to this question, Renee. How do I talk to a close friend who initially made me feel like an afterthought? She was not present and had excuses all the time.
Yeah, that's a great question.
Yeah.
I'm sorry that was your experience. I think it's important to acknowledge that feeling, and if you feel comfortable sharing, I'm a big advocate for being open and honest in our relationships, and you can really center it back. Instead of placing blame on the friend, focus on how her actions made you feel, and that might open up like what was coming up for her, and then you can decide how you want to move forward in that relationship. But focusing on if you have the courage to have that conversation with her, to talk about how you felt in that experience.
Yeah, I am just assuming, Renee, that you've had the same type of experience that I see in counseling sessions. We're just down the hall from each other in the offices, counseling offices. But somebody reframed the experience with relationships to me once, in that almost like there are three categories. There are people who you would have bet that would have been there for you, and they are. And then there are those that unfortunately you had that experience of feeling really let down by their actions and by their perceived absence. And then this third category, I don't know if you've picked up on this, Renee, surprises of people maybe who reached out that you haven't talked to in a long time, a neighbor who maybe reached out, but it seems like those are the three kind of categories of reactions of
Yeah, I see that a lot too. And also like what you have capacity for. If you don't want to have that difficult conversation right now, or it's not the right time, it's okay to also just focus on those people who did show up for you right now.
Yeah, good point. Yeah, just adjusting focus. Next question, Renee, or a reflection. I basically feel fine. My friends and family seem to be stuck back at square one and continue to treat me with kid gloves. Should you be doing that? This is driving me nuts. How do I get them to move forward with me?
Well, again, I think just having that honest conversation and saying, it is making me feel a little bit frustrated when you're being so cautious around me. I actually feel pretty great. My doctors have given me the go-ahead with XYZ. Please trust that I will let you know if I can't do something. Or, word it in a way that sounds like you.
Oh, absolutely right. Because we know and we see all the time that cancer can impact the entire family unit or dyad unit, whatever your case might be, which is why we offer, counseling support to not only the person diagnosed, but their loved ones or people that have those concerns. So. Good question. Can we do in-person sessions, or is everything still over Zoom?
Oh, yeah. So I guess a gift of the pandemic was that our services have expanded. So in person is available as well as video calls and phone calls. So we get that, people are in different situations. Maybe it's not convenient to come and find parking, or you're not feeling that great, so you want to switch to a phone call, that's fine. But we are seeing a lot of people in person right now.
Okay, after treatment, people around me don't understand how the fatigue of treatment is affecting me, and they expect me to do the same activities that I was doing pre-treatment. What can I do in that situation? Any tips?
Yeah, I would recommend, there's a great theory called the spoon theory that was developed by someone who has a chronic illness. Her name is escaping me, but if you Google search spoon theory, there's a great article, and there was even a New York Times like graphic kind of cartoon about it. Essentially, it's we've got a limited amount of energy or spoons in the day, and different tasks are going to cost us a different amount of spoons, whether we're having a good day or a bad day. And so I'd encourage you to read that, and you can share it with your family as well. I think it hits home for people, and it gives them tangible language to share with them, and then it can become a shorthand. Like, I've only got 3 spoons left for the day. I can't go, walk the dog and to a dinner or whatever it may be. But it kind of gives you a way to gauge and to communicate to them where you're at with your energy.
Yeah, good tip, Renee, and especially important as we all know that there's big events with the holiday season coming up very soon, with workplace events and other types of social gatherings, which some people may not at this time feel that is something they want to engage in. So, very good tip and very tangible, and something that people can't see, I guess.
Yeah. Oftentimes you present, like, if you feel good enough to go somewhere, you're feeling good that day. You're gonna be showered and dressed and look great. So people see the optimal version of you. They don't see you on days where you're under a blanket in your PJs. So we have to tell them.
Yeah, or the amount of time it took them
Yeah.
here all to get ready.
Exactly.
Yeah.
Exactly.
Okay, so my kids and family all live out of province. Ooh, are there any counseling services available to them?
That's a good question. Unfortunately, due to our different accreditations on the team, we're social workers and counselors, we have to stick to offering within the province. That being said, I'd encourage them to check within their own province. Often cancer centers will provide counseling support to people who are dealing with a cancer, so they might have access within their own province.
Absolutely. Okay, how long after treatment can me and my family access counseling services?
Great question. We often joke that we have a very weird job because we want to not be needed anymore, or we want to work ourselves out of a job. We want to support you. If it's ongoing or there are other needs, like within the family dynamic, then we would typically bridge to supports in the community. But that being said, we don't have like a set amount of sessions, as long as we're talking about the impact of illness and it's appropriate. Otherwise, if you're asking me about taxes or gardening, I'm going to redirect to someone who's a better fit.
Yes. Yeah, good way to absolutely talk about our services, because sometimes we do have to have that individual what's best, for a family unit and other counseling organizations as well in the community that do a great job as well. How do I get my family doctor to be more involved in my care, especially when when the family doctor says she doesn't know how to deal with anything regarding my cancer treatments and follow-up? How do I talk to her?
Oh, okay. Well, I think this may vary from different cancer types, but I know a lot of them will have a moving forward pamphlet and should be mailed out to your doctor, indicating we're still following up with patient, but please watch for these symptoms. I hope that's the case for you. If it's not, you can talk to your oncologist about that, and certainly talk to your doctor. Like, they should have kind of a guiding principles around what they should be monitoring for, whether that's in your blood work or whatnot. And again, that's going to vary from different cancer type, but I I wish you had more trust in your doctor and didn't feel like you need to advocate for yourself in that way. Hopefully, you can get your oncologist on board to, you know, inspire some confidence in your GP.
Okay, yeah, absolutely. And I'm sorry, I'm looking at the chat here. Let's jump to how long does the recovery phase last? I'm still dealing with a lot of issues.
Yeah, that that really varies from person to person. Some people will still have brain fog for quite a while. Not to discourage you, but it can last 2 years. Some people still have lingering neuropathy. Yeah, there's a lot of things that we carry that people, unless they've been through it, they won't necessarily know. So be patient with yourself. You can ask your care team if there are resources for that, whether, you know, physio or acupuncture, whatever it might be, and to help you manage those symptoms. But yeah, it can be a little bit of a slow journey for folks.
Okay, next question. Can we access counseling services after we've completed treatment?
Yes, absolutely. A lot of people reach out after the fact. They kind of, you know, get their feet back underneath them and go, what did I just go through? So there's no deadline to when you can reach out to us.
Yeah, I don't know. I have no stats, Renee, but I would probably guess we get a lot of people coming through our door at the post-treatment phase.
Yeah.
So when you have time, probably to do a little bit of processing or want to do that emotional processing.
Yeah.
Yeah. Okay, and a question here. I'm not sure what to reply to people who ask me if I'm in remission. I have ovarian cancer and know it will likely recur. Any tips or thoughts?
Yeah, that's a tough one. I think people mean well, but sometimes they can say something that lands poorly because it might not be. Some of you may never have remission, or we don't really use those words, right? It's no evidence of disease. Yeah, so there's a little bit of learning or educating that can happen there, and saying, you know, some cancers don't ever have a remission, depending on how well you know that person, or how much you want to manage their emotional response to that information. But yeah, that's a bit of a tricky one. I would say, yeah, whatever you're comfortable sharing, and it can be just an opportunity to let them know that not all cancers get to use the word remission, and it could be more of a chronic illness type situation.
Oh, absolutely. So Renee, like I know just a little sliver of time with you to cover so many themes that you just did so gracefully. Thank you everybody for the questions. Thank you Renee for lending us your expertise. And yeah, I'll catch you at lunch break.
Okay,
So,
thank you.